Canada population, crude birth rate and crude death rate of Canada. Crude death rate is 7.5 per thousand and the crude birth rate is 10.8 per thousand. The life expectancy in Canada is 82.3 years old. Introduction to the problem. In Canada, the fertility rate has been decreasing. Based on the graph shown, the fertility rate is 1.56 babies per woman in Canada. Although that does not sound too bad, there are many problems that will occur when the fertility rate decreases further. One problem is that many businesses will be lost due to the lack of workers because the low fertility rate causes there to be an aging population. This means that there will be more people who are unemployed slash retired slash underemployed than actual workers. Another major problem in the economy if the low fertility rate continues is that the businesses will start to face a drought in income as there will be less consumers. Also, the aging population means that less consumers will go out into stores as many elderly people do not go to stores often. If they do go out, they would probably only go out for groceries or clothes. How fertility rate affects Canada. Due to the low fertility rate, all the non-working class aged 0 to 14 and 65 and above has been increasing. If this continues, Canada will suffer a lot as the Canadian government is highly reliant on the citizens' taxes in order to consistently pay for social services such as healthcare, education, retirement programs, and general operating of the country. So if there is an imbalance in the non-working class and the working class, the government will not receive enough money to be able to sustainably pay for all the social services. How low fertility rate is caused. One of the factors is education. Nowadays, many women have been to school and they have learned to use contraception to avoid having a baby. Many women have now also been joining the workforce. According to the Catalyst, 57.4% women have joined the workforce, which is much higher than before and not too far compared to the 69.7% of men in the workforce. By having more women in the workforce, they become afraid that they will not have enough time to take care of a child, or more than one child, which contributes to the low fertility rate. Another factor is the huge decrease in child mortality. According to UNICEF, they have been able to reduce child mortality by a whopping 59%. In 1990, the average number of child deaths was 93 for every 1,000 births. Now the average number of child deaths for every 1,000 births is 38. The third factor is better access and knowledge about contraception. Adding to the first point, now it is much easier to purchase contraception and birth control pills to prevent any accidental births. They are being sold in everyday local stores around the world to make it easier to access. The final factor is that there has been an increase in older marriages. This is a problem because due to some cultures believing in having kids after they get married, they tend to want to have a fewer number of kids as they feel that they are too old to take care of more than one child. Some solutions. Many countries around Europe have tried different ways to approach the fall of fertility rates. Something that was frequently used was to pay a family for every child they got. The government would pay 800 to 1,000 euros per baby in Italy to try and encourage families to have more children. Although it may have seemed like a solution, there was not a very high increase after this was announced. In France and Scandinavian countries, whom have the highest fertility rates in all of the EU, have been not only paying families for their children, but they have also been reducing the cost of things for families who have two or more children. They have also been increasing the pay for parents who have two or more children to help ensure that they will not have a shortage of money to take care of their children. In Sweden, parents are allowed to a 480-day paying leave off work to spend time and take care of their children. This allows them to not worry about their money and to be able to focus on taking care of their children. So some solutions I thought of was paying families for every baby they have. This will encourage families to have more children. Another solution being for families who have two or more children, decrease the prices for housing, school, healthcare, and increase their income so that they won't have to worry about um, not having enough money to sustain their children. Another solution is allow a 400-day paying leave off to work to spend time and take care of their children. And the last solution is to inform everyone in the country about the problems of decreasing fertility rate so that people understand how they can help solve the problem. These are my MLA sources. Thank you.